Good afternoon to all. I am Dr. Asavri Sawant, Public Health Specialist at IHW Council, and I welcome you all to this exclusive Guide to Good Gut Health series, an initiative by Integrated Health and Wellbeing Council powered by JB Chemicals and Pharmaceuticals. May is the National Health Awareness Month, recognized every year by the Government of India. Integrated Health and Wellbeing Council, powered by JB Chemicals and Pharmaceuticals, has organized this brilliant initiative to raise awareness on the growing burden of gut health amongst children, to share with parents the guide for good gut health. This live session, we will discuss on the topic of the importance of zinc in diarrhea, for which we have a very eminent speaker here with us. I welcome Dr. Dhruv Desai, who is the consultant pediatric gastroenterologist and hepatologist and is associated with Prime Hospitals in Rajkot. Sir, we welcome you to the show.
Thank you so much. Thank you so much.
Okay, so as diarrhea, we have seen that it is very common amongst young children. About 40% of young children suffer with this disease. So as a pediatric gastroenterologist and hepatologist, what are the common causes of frequent diarrhea that you see in children?
Correct. So there are various causes from commoner to less commoner. The most common causes are viral infections that do happen in summer or in the winter season. Secondly, food poisoning is also very important cause. Food allergies, excessive milk intake or excessive juices intake. There can be recurrent diarrhea or frequent diarrhea in cases of deficiencies such as zinc deficiency. It can be due to irritable bowel syndrome, inflammatory bowel disease, celiac disease, lactose intolerance. It can be due to chronic infections or weak immunity such as immune deficiency, etc., etc. So there are plenty of causes which can cause diarrhea in children, especially frequent diarrheas.
Sir, is frequent diarrhea also common in young children below 6 months of age who are completely feeding on mother's milk? Is diarrhea seen in them very commonly as well?
Correct. So milk protein allergy is one of the most common cause of diarrhea in infants who are 6 months or below. And they are also seen in children who are exclusively on breast milk because the mother usually consumes milk and milk products. So that can cause diarrhea in children, which is the most common thing.
Thank you so much for explaining all these things. Sir, we have commonly seen that with children, sometimes they are having hard stools, sometimes they are having watery stools. So how can parents identify if this is diarrhea for sure and it needs medical help and it should, needs attention beyond their home remedies that parents usually do? And there is, this need that they need to go see a doctor. So what are those signs that persist among with diarrhea that parents should be able to recognize that medical attention is required?
Right. So first and foremost, if the diarrhea persists for more than 2 days, or if the frequency of the diarrhea is very high, large volume watery diarrheas frequently, if the child is not able to take appropriate liquids which can compensate for the water loss which is happening in the diarrhea, if there are any signs of dehydration such as excessive thirst, excessive weakness, headache, if the child is feeling vertigo or anything else, these are the signs. Or if there is decreased urine output or less urine output is also a sign of dehydration. So in case of all these findings, you should immediately contact your pediatrician or a pediatric gastroenterologist. Also, there can be blood in stools or excessive abdominal pain. So these are also important findings or the red flag signs that a parent should see. If present, then the child should be taken to hospital or a doctor.
Thank you so much, sir. So while you were mentioning the different factors that can lead to diarrhea, one of the factors was excessive food intake. So can you please elaborate on this topic? Are there any particular foods that are seen to cause diarrhea amongst children, or is it just excess of any food item that may harm and cause diarrhea?
So there are few food products which if taken in excessive amounts can lead to diarrhea, or it can worsen diarrhea, or it may hamper the recovery from children who have diarrhea, especially milk and milk products. We have frequent children visiting to us. The parents, they do themselves say that, sir, our children only consumes milk throughout the day, and they usually consume approx 1 liter of milk throughout the day, which is not good for the gut, and they result in diarrhea. Fruit juices or drinks which contains lot of sugar levels or sucrose levels, they can also cause diarrhea. There can be some few fatty meals or high fat foods such as fried food, outside food, fatty foods. This can also cause diarrhea. So these are the foods or drinks that can cause diarrhea in children.
Thank you so much, sir. Sir, I remember I have been diagnosed with lactose intolerance myself. So I was told by doctor that you shouldn't consume any form of milk products, just yogurt you can consume. So can you please elaborate if yogurt has something different, and does that also causes diarrhea or not? And with people with lactose intolerance, how to go about so as to avoid diarrhea while regular food eating?
Right. So lactose intolerance is one of the commonest causes of diarrhea in children. Lactose intolerance itself, it means that the lactase which is there in the milk, it's not digested properly, and thus it causes diarrhea. Also, it hampers in the recovery. So obviously, milk and milk products are not allowed when you have lactose intolerance, because most of them, they do contain lactose, which is not digested well. Especially yogurt. The thing about yogurt is that it has the probiotics, the natural probiotics in it, which helps the recovery of the lactase enzyme in our gut, thus decreasing lactose intolerance. So yes, yogurt you can take, especially because of the probiotic contents in them.
Thank you so much, sir. So, as today we are discussing the importance of zinc and the role of zinc in the treatment of diarrhea, could you please help us explain on this point how beneficial it is, and is it commonly used as a diarrhea treatment?
Okay, so recently in last many years, zinc have been in the guidelines of treating viral diarrheas, acute diarrheas, recurrent diarrheas. Many studies have been published regarding the same. And basically, what zinc does is that it improves the fluid and electrolytes absorption. So whatever fluid the child is taking, maybe ORS or anything else, that absorbs into the body and prevents dehydration. It reduces inflammation, it improves epithelial regeneration. So basically, it improves the healing of the gut, and it also improves the immune system. So if the immunity is good, then the possibility of again getting the diarrhea decreases with zinc. So yes, zinc is usually regularly prescribed by almost each and every pediatrician or doctor around the corner, and it is mentioned in a lot of guidelines also that zinc should be given in cases of diarrhea.
Thank you so much, sir, for explaining us that. We also wanted to know that does zinc deficiency also contribute to the severity in diarrhea? If the person is deficient in zinc, can it lead to him having a severe form of diarrhea than somebody who is not deficient? Can you please help us elaborate?
Correct. So basically, as I mentioned just a few seconds ago, zinc deficiency will cause weak immunity. So you will be susceptible to all the viral and bacterial infections very easily if you are zinc deficient. Second is zinc deficiency will impair the absorption of food and water and electrolytes. Again, it will prolong the illness. Means if you have diarrhea and if you are zinc deficient, then there are higher chances that the diarrhea will get prolonged for few days or in severity. It also delays the termination of normal self-limiting gastrointestinal disease episode. That means that some illnesses are self-limiting, means when they happen they do limit themselves or they get treated by themselves within few days. But if you are zinc deficient, then the duration will increase. So all these factors means that if you are zinc deficient, then there are greater chances of you to have diarrheas because of weak immunity, weak gut, and there are more chances that the diarrhea might be severe or they can increase in frequency also.
Thank you so much, sir. So, sir, are there any specific signs or symptoms to understand if the person might be zinc deficient? Any such as the way other deficiencies and vitamin deficiencies show signs on child's body. Does zinc deficiency also show clinical symptoms?
Well, zinc deficiency in particular, it's very difficult for anybody to, especially for the parents, to what you say, to recognize it in their home environment. But usually we suspect zinc deficiency in children with malnutrition, those who don't have good growth, means growth failure. They are not keep the weight and the height of as expected as per their peers from that age group. Uh, Diet is also one of the thing. If a child is more on packet foods, milk foods, outside food, junk food, then obviously children are going to be zinc deficient, and because they don't eat regular fruits and vegetables as required by their age group. So, if you find that your child is not growing well, if you feel that your child is having frequent infections, if you feel that your child is having poor skin, some skin problems or diarrheas or stomach on and off stomach problems, so this could be the sign that your child might have zinc deficiency.
Thank you so much, sir, for answering our queries. On the same note, to all the parents that are watching, most of the parents are really worried about their children bunking classes due to illness. And as diarrhea is so frequent amongst younger school going kids as well, that parents want all sorts of different measures to keep their child's health in the fittest possible shape. So, as it is very common for children to gravitate towards unhealthy food options and processed food options than home cooked meals. How can zinc supplementation help? And can we advise the parents to look into these options if their child is not getting proper meals at home or not eating properly?
Okay, so actually, uh, see, diet is one of the most important thing. Means there is a saying that if you have a good diet, then you have a good gut, and if you have a good gut, then there will be obviously decrease in the chances of getting diarrhea and everything else. So you should have a good hygiene, hand washing, and good food habits. Home cooked food is pretty much good. More of fruits and vegetables should be taken, less of packet food and junk food. Good water intake. Obviously, you should get a good regular doctor visit just to monitor the growth of the child and get vaccinations also. Diet, as I said, is most important, and the zinc, the sources of zinc, mainly it comes from fruits and vegetables, so it should be taken. If you feel that your child is not having proper meals and they are not taking what is recommended for their age group, you can take multivitamin and zinc supplementations like once in 6 months or twice in year, which will be prescribed by the doctor you are showing to. So that might help to prevent zinc deficiency.
Sir, we also wanted to know if there are any side effects that are associated with zinc supplementation in children, and if there are any studies that are, currently underway that are checking the long-term effects and also the immediate effects on children on supplementation with zinc.
So usually, zinc is very safe drug. I mean, I don't remember last time when I had seen a children or a child who had side effect with zinc. But yes, they might get few common side effects like they may cause indigestion, they may cause nausea, vomiting, some pain abdomen, decreased appetite can be seen if it's taken for a longer period of time or in high doses. There can be headaches. But all these side effects are pretty common, and they are very small in nature, and they are seen in very less people or very less children.
Thank you so much, sir. Sir, coming back onto the topic of diarrhea for younger children, can you suggest any sort of home remedies to parents that are watching to be taken, food options that are good for preventing diarrhea amongst very young children?
Okay. So there is a diet called as BART diet. So BART means BRAT. B stands for banana, R stands for rice, A stands for applesauce, and T stands for toast. So this diet has been extensively studied. So if your child has diarrhea, and if you give this BART diet, there is higher chances of good recovery, earlier recovery, less frequency of loose stools, and it will eventually help the child get recovered from the diarrhea. There are a few other sources also, such as yogurt, as we earlier discussed. It has a good amount of probiotic, and if taken properly, then it may prevent as well as cure the loose motions or diarrheas. Uh, you can give other low fiber foods such as rice, white bread, some lean, smooth peanut butter, and there can be drinks which can be given such as ORS or other drinks which has low sugars and high amount of electrolytes, because sodium and potassium levels, they do drop when the child has diarrhea. So these are all the things that your child should take on a regular basis. If you want to prevent diarrhea in your child, obviously the goal is to give more of fruits and vegetables to the child, so that there are no deficiencies and the gut health is good.
Yes, sir. Thank you so much. And we also wanted to know that what should parents do if after using such home remedies as well, the child is not showing any signs of improvement and is experiencing recurrent episodes of diarrhea, despite, giving them BART diet or specific food items, then what should be the way forward?
Right. So obviously taken for granted is that if the child is having recurrent diarrhea, they have taken few medicines, so they have consulted few doctors, and regardless of trying everything, the child is still having diarrhea. So in this case, the pediatric gastroenterologist should be on your priority list, because he is the one who can advise further investigations and treatment. Because if the child is not improving with these all regular things, then your child might have some other problems, such as celiac disease or inflammatory bowel disease or immune deficiencies or allergies, which might need further investigations and proper treatment. So you should definitely consult a pediatric gastroenterologist in case if there is recurrent diarrhea or the diarrhea is not improving.
Thank you so much, sir. Apart from the diseases that you have mentioned, which are usually nutrition or food related disease, are there also any other systemic or metabolic diseases that might come about as diarrhea at first and would require, further deeper investigation, more seriousness of thought from doctor's side or more tests? Also, we would want to know how the treatment of diarrhea, what is the protocol for diarrhea treatment, and what usually it entails to inform the parents.
Okay. So yes, definitely there are pretty extensive list of the diseases which can cause diarrhea beyond the regular ones, such as inflammatory bowel disease. Means that your whole intestine itself is inflamed, and it's not able to tolerate the food, or it's not able to function properly. There can be irritable bowel syndrome also, where it gets regularly irritated by something else. Metabolic diseases, yes, obviously there are lots and lots of metabolic diseases, galactosemia, and there are a lot of diseases where the metabolism is pretty much not developed since childhood and can result into diarrheas. So Celiac disease is again one of the most common thing. For a layman, it's wheat allergy, but actually it's an autoimmune disease that will affect a lot of other organs also, which may lead to diarrhea as well as underdevelopment, failure to thrive. There will be malabsorption syndromes, which can also cause diarrheas. Chronic infections like HIV and other infection can also cause frequent diarrheas. So these are various causes where the parents should consult a pediatric gastroenterologist for further investigations. And what was the second question you asked together?
Sir, what is the treatment protocol for diarrhea for informing the patients? How does the
Correct.
treatment of diarrhea is usually
So,
done?
correct. So when your child gets diarrhea, first just observe the child, give plenty of liquids, especially ORS, which is readily available in all the medical stores. Observe the child. Sometimes, if there is a mild condition like some viral infection or some food allergies, it will go away within a day or two without affecting your child much. But if you feel that the child is not recovering as properly as it should do, don't take medicines by yourself from medical stores. Consult a pediatrician or a doctor or your family doctor or a pediatric gastroenterologist just to see whether they need any antibiotics or they need any probiotics, or if there are any signs of dehydration which the parents are not able to recognize. The children might need hospital admission for IV fluids and other supportive treatment. The main goal in usual cases of diarrhea is to avoid dehydration and give plenty of hydration to the child.
Thank you so much, sir. So, sir, as India is currently and the different nations are currently focusing on millets, consumption of millets more than processed flours, how can improving such options in a child's diet help in maintaining overall gut health? And what would be your advice to parents on how to how to put a proper nutritious plate for their children of different age groups? So starting from for about 6 months to 2 to 3 year old toddlers and then beyond, what would be your advice of incorporating nutritious items for maintaining good gut health?
Correct. Diet again, as I have been saying since the start of the session, that it's one of the most important thing the parents should undergo. Starting from 6 months to toddlers, say, till 6 months, the child is obviously on exclusive breastfeeding. So when you are starting the outside food or weaning the child from weaning foods are started, you should mainly focus on the variety of food that you give. Don't stick to only few options. Or I have seen parents that they would say we are giving khichdi throughout the day, so that's a wrong process at all. You should give fruits, you should give vegetables, you should give whatever you are eating, which is home cooked, to the child starting from the very beginning. Toddlers, they do have some tantrums regarding the food, but actually if you plan regularly, if you don't give them much options, if you feed what you are having, they eventually develop that habit of eating everything which you are eating. Ideally, a combination of grains, pulses, vegetables, fruits, everything should be there. And our Indian diet is pretty particular about it. Whatever the thali which we have is pretty good. A lot of actually the thing is that the chewing is also very important. I have seen, I think most of the children who visit us, either they have their food by watching iPads or TVs, then they don't have control on their diet. Sometimes they undereat, sometimes they overeat, sometimes they don't chew properly. So these are also not good signs for good gut. uh, Adolescents or little older age groups such as 8 9 years or 10 years, they are more involved in junk food, and they literally are like every alternate day, or sorry, 2 to 3 days, they usually consume a lot of junk food, and that is really not good. they also get overweight, they decrease their exercise activity and everything, and eventually all this leads to their poor gut health. So my recommendation is that all the children should definitely consume a lot of liquids, especially water. They should take proper amount of fruits and vegetables throughout the day. They should take adequate amount of proteins, and they should limit the junk food, particularly once in a week or 14 days. So this is all I should recommend to all the parents.
So we would also want to understand that does these pre-made food mixes that are given to younger children, such as cereals and pre-made boxed nutritious packets, are milk additives, such as, I won't be naming any brands, but mixes for the milk, for nutrition, or the pre-made boxed cereals for toddlers. Do these also affect diarrhea in their gut, because these are obviously high in sugar than fibrous food and less in fiber? So would this also affect, and does consuming excess of these boxed food items, although being very convenient for parents, but does this also hamper the nutrition of the child over the long run and causes diarrhea and other gut issues?
Yes, definitely, definitely. See, obviously, anything which is packed and which is there lying on the shelf of the medical store for a longer period of time, it has to have something that doesn't let it get rotten. So there are chemicals which have been added. There are high amount of sugar, as you mentioned. Yes, they are fortified with few of the vitamins or few of the minerals, which they claim that it is good for the children, and to some extent it might be, but the more problem is that the child, they, because of the higher sugar content or because of the taste, they do get addicted to that food packets or whatever the ready-made cereals or milk products, and then it's very difficult them for the childrens to convert them for a regular diet. The taste of the packet food is so much good that the children's, then they don't consume the regular diet which the parents give, and parents do find it difficult for themselves to convert their children from packet foods to the regular ones such as fruits and vegetables. So definitely yes. Second, because of high milk content, high sugar content, obviously your gut is going to get disturbed, and there might be higher chances of diarrhea and loose motions. Sometimes in a hurry, we sometimes forget to take adequate hygiene measures, and because of that also it can lead to infection and diarrhea. So I would recommend that please decrease the intake of all these packet foods or cereal mixes or the milk products which are available in the market, and give the food which is home cooked, which is fresh, and which is full of multivitamins, proteins, and minerals and everything.
Thank you so much, sir, for this amazing session with you today. Our very last question to you is, can you please help us understand how diarrhea in children is different from diarrhea in adults, or are these two pretty much the same?
So diarrhea in children is more due to the lack of immunity, because the many children which we see, they don't take a good diet, so they are running low on the vitamins and minerals, and because of that there is low immunity, and because of that they do get frequent viral infections. So that is one difference, because the children's gut is growing and it's still not mature enough to fight all the organisms, or it's not that strengthful. So there might be some allergies, or there might be some easy infections which can happen in children's. So the main difference is that the children, they get more of viral diarrheas as compared to adults, where they get more of bacterial illnesses or from the foods which they take outside.
Thank you so much, sir. And the closing question for you would be, what would be your advice to all the parents that are watching this show for maintaining their child's good gut health? Any tips that you would want to give apart from we have been discussing the role of diet and nutrition and maintaining good gut health, but what would be your key takeaways?
So my key takeaway is that maintain a good hygiene. Don't let your children's eat outside food. Hand washing is one of the most important thing that can prevent diarrheas. Many children they do get nail biting and put fingers and other stuff in their mouth. Please avoid it. Make your child eat home food, less of packet food, junk foods. Regular doctor visit is a must. If your child is not taking proper diet, multivitamin and zinc supplementation, you should give them intermittently. If the child is around adolescent age, make sure they do exercise regularly, because less of activity also will decrease the health of the gut. Chew the food properly. Don't give your child too much stress. If they are taking stress, stress is also one of the important factors that cause poor gut health. Take and eat probiotics or prebiotics if and when possible. Eat more of fiber food, limit caffeine intake, limit TV and mobile or screen intake, and spread awareness about the good nutrition to all the parents.
Thank you so much, sir. We would like to thank Dr. Dhruv D. Desai for taking out time from his busy schedule and sharing with us the wealth of knowledge and information on this topic today. Thank you so much, sir. We would we would also like to thank our partner, JB Chemicals and Pharmaceuticals, for this brilliant initiative for informing all the parents about Guide to Good Gut Health. Thank you so much. Lastly, we would also like to thank our viewers for staying with us till the very end. I hope this session was very insightful and informative for you as well, just as it was for us. Thank you so much. With that, we sign off now. Stay happy, stay healthy. Thank you. Thank